But it's clearly a genetic problem. But do you see that those issues are compounding generation after generation? And I guess what's your take on all that stuff? Orthodontic work and our underbites, overbites, all those things getting worse. I guess what kind of stuff can you enlighten us with on that?
Yes, very good question. Thank you for asking that question. So, um, the first time most parents are exposed that my kid might have an issue is either they have cavities or they are between the age of 10 to 13 and they are seeing a bunch of teeth that are coming in and everything is super jagged, right? Like that's when they go see the dentist and the dentist say, well, there's not enough space for all your teeth, let's send you to the orthodontist. So the question that we need to ask even before we throw some brackets and try to straighten teeth out is, why do I have crowded teeth? Why does my child have crowded teeth? And it goes back to the same thing. The tongue did not rest on the roof of the mouth, the upper jaw did not expand, and the lower jaw is a function of the upper jaw. So if your upper jaw is growing forward and side to side, the lower jaw pretty much follows it in 3 dimension. So if your jaws are not developing, there's not enough space. So if there's not enough space, then that's when you'll start seeing teeth being crowded. What happens is when we try to straighten teeth, we are not addressing the elephant in the room. The elephant in the room is the problem is the tongue did not sit on the roof of the mouth. We have muscle imbalance. We can straighten teeth all day long, but for teeth to stay in the straightened new position, we first have to balance the muscle. The dynamic interplay between your lips, cheek, and tongue determines how our jaws sit in 3 dimension. So, if you have an underactive tongue, your lips and cheek are compensating. So, every time you're swallowing and swallowing incorrectly because your tongue is not doing its job, then the vector of the force is backward. So, it further exacerbates the problem. So, more teeth are crowded with time or stay crowded. So a lot of the times people will get teeth straightening, orthodontics, go through braces for 2 years. They're in retainers. They stop wearing their retainers, and after a few years, their teeth start moving back. This is all day long. I see it all day long. So when that happens, it's just because the teeth shifted back because of the pull of the muscles. So it to me it always makes sense to first start with the root cause of the issue. The root cause of the issue is there's an imbalance between the muscle. Let's start there.